Welcome back to the Dental Clinical Companion, where we bring together the world's leading clinicians and experts to optimize your treatment, educate, and inspire and energize your professional goals. And now, here is your host, Dr. Richard Mounts.
We are live from Studio 1A in Neskowin, Oregon, on the beautiful Oregon coast. Welcome to this episode of the Dental Clinical Companion podcast. I'm your host, Dr. Richard Mounts. This episode of the Dental Clinical Companion is produced in partnership with Medmark, the U.S. publishers of Dental Sleep, Endodontic, Implant, and Orthodontic Practice magazines. Experienced and novice dental professionals alike turn to Medmark Media as their trusted source of information, knowledge, and education in the highly technical yet constantly evolving dental landscape. MedmarkMedia.com. Welcome to part 2 of my podcast with Dr. Aniko Ball from Melbourne, Australia. In part 1, we discussed the scope of the problem of chronic occupational pain and some common habits of dentists that precipitate some pain. And we discussed some specific techniques for reducing that pain. Dr. Aniko Ball, welcome to part 2 of our podcast together.
Hello, Rich. It's my pleasure to talk with you again.
Oh, thank you for coming back. I'd like to start our conversation where we left off in part 1, which was a fascinating concept you had regarding extraction technique that you described as all of me. And I would like to give you an opportunity to describe that again in part 2 and in as much detail as you'd like for our listeners, because I think this is really something that is worth elaborating on further, even more than we did in part 1. Can you describe that, please, for our listeners?
Yes, I can do that. I find that in Australia, most dentists are standing up when they do extractions, but some sit. And what I teach is to stand in a kind of a lunge where if say you're on the right side, right-handed dentist on the right side of the patient, however, I encourage them to move wherever I need to be. That would mean that your left foot is forward and your right foot is back, so that you can then stand in such a way that you can bend at your hip, knee, and ankle just slightly. So it's a springiness that I encourage dentists to have in their body, even though you're not bobbing and bouncing around. And then if you can think that instead of using only your arm and shoulder, your right side, if you're right-handed, to work and exert a lot of force to extract the tooth. And initially, all you want to do, of course, is to get higher up on an up tooth or lower down along the tooth root on a lower tooth. So you're just pushing and pushing to get your grip further and further along the tooth root. I've seen a lot of dentists sustain injuries to their arm, wrist, elbow after difficult extractions, or the least that happens is they're extremely fatigued because they don't work their whole body. So I like to recommend the idea of thinking that all of me is helping me extract. It's like I've got a whole team. My whole body is helping me. It's not just this poor arm and hand and shoulder. And it's a little bit like driving a 10-cylinder car only on one cylinder. When we just use our arm on its own, then we're working one cylinder. If we think of all of me, then we're using all 10 cylinders to get the job done. The power base is the hip joints and the powerful muscles of the leg and hip. And when we have a springiness, even in sitting, if we just either do a little bit of a pivot, as you're listening to me, for example, if you're sitting, just a little kind of moving back and forth at your hip joint, or even just thinking that you're doing that, suddenly takes the power of the hips into your arm. And then if you are holding any instrument, and Rich, in our previous discussion, you connected that idea to even holding a reamer or any file that you might be using. Same with scalers, but let's now talk particularly about extractions. The power of the hips will be transferred onto your instrument without straining your arm. So all that your right shoulder, arm, and hand is doing, if you're a right-handed practitioner, is just allowing the transfer of that force. And participants in my training program, when they experience this, and I get them to place forceps on a mannequin teeth, they are shocked at the power, and they feel that their arm is doing nothing. Then I get them to contrast it with what they normally do, and it's a world of a difference.
Wow.
Now, there is another point I'd like to mention, and a lot of dentists tell me that their non-dominant hand, so the left hand for a right-handed practitioner, which is just on the patient's around the sulcus and the supporting the alveolar bone, as we do. Often, when they finish doing the extraction, they have incredible pain and fatigue in that hand. And what I notice is that there is a lot of force exerted by that hand, which is not doing any extraction. So I'd like to point out the importance of noticing what the other hand is doing, because in the same way that I suggested in our first podcast, that when you place your hand in the mouth, the non-dominant hand holding the mirror, and you're using directional thinking of releasing the weight of the arm onto that point where fulcrum where your finger is resting, in the same way during extractions, let the other hand just be released onto that point where you're simply holding the labial and palatal, or wherever you are, bone, because it doesn't need to do anything.
Got it. Okay. I appreciate that clarification. Was there more that you wanted to mention?
Yes, I would like to also talk about the all of me principle when it comes to reaching for things. When there is repeated twisting, then there is a repetitive strain injury, cumulative trauma to the body and especially to the spine. So what I see dentists do repeatedly as they're sitting and doing operative dentistry is that they are twisting, let's say a right-handed dentist, twisting off to the side to pick up a handpiece or replace it, or reaching for the tray, or reaching for anything. And that little repetitive twisting off to the side is enough to cause long-term pain syndrome. So let's apply the all of me principle again. And remember, you're sitting on a dental stool that can easily pivot, and twist and pivot with your whole body rather than just being in a fixed seated position and twisting off to the right. Now, when it comes to using a microscope, that's different. Is everything being handed to you, Rich?
Generally, yes. Good. With a few exceptions, yes.
Right, because for you can't really twist because you're looking down a microscope. So I recommend as much as possible for those of you who are listeners are using a microscope, as much as possible to have everything handed to you. And also, if you can have hand pieces that can be, for example, the continental delivery, or there are certain deliveries where you don't have to accurately replace the handpiece and fear that it will drop, so that you don't have to twist off to the side.
Yeah, very, very interesting. That's a really good point. It's something we instinctively do, but don't think about it, and it's causing harm. So I appreciate your mentioning that. I'll never be able to turn around again without moving my whole body. So I will do that moving forward, I promise.
Right. And there is one more thing while I'm talking to you and the listeners have an opportunity. Another really important aspect, which I didn't have a chance to mention, is that when you're sitting anywhere, but especially doing dentistry, to have your feet flat on the ground and the ankle should be underneath the knee. That is the biomechanical design, weight transfer. And for ladies, please do not wear high heels at work or anywhere ideally, because it throws the whole spine out and your pelvis. And all the knees should be pointing outwards. So for the female listeners, if you have been taught that ladies must sit with their knees together, that is terrible advice. The way guys just sit with legs open is actually the way that the leg was designed to bend. The head of the femur rotates outwards when the leg is bent, which means that we can't wear miniskirts or tight skirts, and we shouldn't be, and certainly not for work. So ladies, please start sitting unladylike, more like guys. And when you are sitting behind your patient and your foot is on the foot control, make sure that you're stepping on the foot control with your knee falling outwards. I had a habit, and many dentists do, of my right knee going inwards. I had tremendous issues with my hip and lower back. So line up your foot control before you get into the patient's mouth. What I often see, Rich, is that dentists are gloved up, looking in the patient's mouth, instrument in hand, and suddenly the feet are starting to look blindly for the foot control. Organize it before you start so that you can put your foot on it in a way that's good for your body.
Oh, those are great tips. I really appreciate your sharing that with our listeners. Your website mentions, quote, I'm quoting now, in-house, and then a subquote, stress management in the clinic workshop. What do you see as the primary stresses your participant dentists are reporting to you?
This is a question I've been engaged ever since I was in dental school. I realized when I was in final year dentistry, after seeing a study by Victorian dentists a few years earlier, that I was about to graduate into a very highly stressful profession. And so I've been engaging with it for decades. What I see as one of the biggest stressors is that we're seeing day in, day out patients, most of whom, certainly the ones I know of, are frightened, anxious, because they fear that something uncomfortable or painful will happen, or they've had some terrible experiences by another dentist in the past. And the way that fearful patients tend to mask their fear is to cover it in a kind of a prickly, at times slightly hostile outer, or they might be annoyed because they think that dentistry is costing too much. That's another way that they present. And we haven't learned, for the most part, I certainly worked out for myself, that although this is coming at you personally, it's not personal. And if we see day in, day out enough patients who are undelighted to see us, who are not thanking us and expressing gratitude, it's easy to feel unappreciated and somehow take it personally. And I like to use a metaphor where when you're out in the rain, Rich, you will get personally wet, but the rain didn't just rain on you personally. Everyone gets wet. And so what I find very helpful, and I worked this out very early on as a young dentist because I delved into this in a big way. I didn't want to be one of those statistics who was either burnt out, or we also have very high suicide rate, high stress levels. I wanted to look after myself. And so I worked out this idea that whenever I saw someone who wasn't very pleasant or anxious or anything but lovely, I named that, I labeled that patient, and I use this, you'll laugh at this. In Australia, we used to have an ad promoting Vegemite, and they showed these little children, and they were called Happy Little Vegemite. So I started labeling. Do you like that?
I like that.
So I started labeling. If I had someone, and often I didn't notice it, but suddenly I just noticed that I'm kind of tense and uptight, and then I realized that I have a patient who I started calling an unhappy Vegemite. And as soon as I used that, and that was a code word for me not to take it personally and remind myself that I was just seeing the mask of unpleasantness or hostility or prickly behavior, whatever it was, at times angry behavior, that was just a mask for a very frightened person. And that allowed me to have some compassion and then pull out my stress management techniques for myself and the patient. Because if I take it personally, and many dentists are taking it personally, I see this on dental Facebook groups dealing with emotional stresses. And it's so important to get that it's not personal, but it's coming at you personally. Is that making sense so far?
Yeah, it absolutely does. And not to take us away from our topic, but suffice it to say that it took me years to figure out that the patient was nervous and anxious, and that it wasn't about me. That that I didn't own their anxiety, and especially in endodontics, because it's a filter in a referral-based endodontic practice for all of the most difficult, anxious patients and most challenging clinical cases. So it's kind of like the worst of all worlds in that sense. But it took me a long time to figure that out. And like you, once I realized that it wasn't about me, then solving the problem became much more manageable. But that leads perfectly into my next question, Aniko. In general terms, what are some of the strategies that you teach to manage clinician stress in the office?
Yes, so a big one is time pressure, and I have a beauty for that, which can easily be explained in this podcast. Because what happens is that when we look at the clock, and thank goodness, I don't know about America, but in Australia there are less and less amalgam restorations being done. But there was a time when I would say to patients, please don't bite, and they would bite, and suddenly everything crumbled and I was way behind, or there's an emergency patient. For whatever reason, we feel time pressure. And when we feel time pressure, then we panic, our thinking mind goes offline, and we're in fight, flight, freeze mode, and there are stress hormones just coursing through the body, and suddenly we're awash with adrenaline and cortisol. So I have a wonderful way of dealing with time pressure, and this will seem overly simplistic at first, but I recommend you try it because it works. And I've tested it over and over, and I teach it in my courses. When you are feeling that you don't have time, and usually you can't even think straight, if you say to yourself, and you need to repeat this over and over silently to yourself, I have time. But you need to say it the way I'm saying it now, in a very calming, soothing way. I have time. I have time. What that does is it stimulates the release of endorphins. It's a self-soothing technique, and it works even when you don't have time. And suddenly time seems to expand, and your thinking mind comes back online, and you're able to do whatever you need to do. And I've used it in situations in dentistry, outside dentistry, and it works every time. It's just a way of soothing your system, calming. So that's the first one, because time pressure is a big one. Another one is mind-body calming techniques that, again, I teach to everyone, and it's very simple. And I use it also for my patients. But let's talk about calming the dentist first of all. And I started doing this a long time ago. And before I talk about this, let me just stress the importance of learning to recognize very early on what your stress signals are. It's like if you don't have a smoke alarm in your house, then you won't know that there's a fire happening. So the earlier you are alerted to the fact that you're actually feeling stress and it's all building up, the earlier you can do something about the fire. It's like turning on the air conditioning before the house gets too hot. So notice the next time someone annoys you, or you're driving on the freeway and someone cuts you off, or any situation where you're stressed, just notice what happens to your breathing. If you feel contraction in any part of your body, it might be your chest. There are definite telltale signs, and get familiar with that, because as soon as you notice it, that's when you want to apply it. And the earlier, the better. So I have a very simple technique. And I'll say it now as I would say to myself or to my patients. And it's really important to talk to yourself, even silently, in a very calming way. So just notice. You don't have to change your breathing. Just notice the next in-breath. And notice the out-breath. Notice the way the chest rises and falls with every breath you take. And imagine or think or pretend that you could soften the breath and soften the body with every breath you take. So that's the technique, noticing the in-breath, noticing the out-breath, noticing the way the chest rises and falls with every breath, and imagining that you could soften the breath and the body with every breath you take. So it's that simple. When I say notice, and I usually say this to patients if I use this, and I can use this technique and take an impression on the biggest gagger. It's amazing. It really calms them down. I just say notice or pay attention, or whatever way you notice is fine. So have a very permissive approach, and same for yourself. And then noticing the out-breath. And why I usually like to say, just imagine, think, or pretend you could when it comes to softening the breath and the body, is that some people will say, look, I can't imagine. It doesn't matter how they do it. What's important, and you probably noticed that I'm going to do it now as I'm talking, is that if I'm talking to a patient, I slow my speaking. I'll have gaps between my words. And I'm really bringing my voice tone down, which is very hypnotic. And you got to watch that your dental nurse doesn't go into trance, because mine used to regularly. And you can use this dropping the voice tone technique, and this comes from my hypnosis training, even as you're explaining a procedure to the patient, and that's a kind of a conversational hypnosis, because people just calm down. So whether you're using this technique for yourself or your patients, there is a tremendous release of endorphins, which is the anti-stress hormone or medicine. And suddenly everything just becomes calmer and time expands, and you will have referrals to your practice because you will be known as the dentist who makes people so comfortable.
Yeah, that is outstanding coaching, and I really appreciate your sharing that with our listeners. And at the end of the day, I don't remember the exact expression, but it's something about they'll know how much you care, in terms of and what you're describing is a great way to communicate that empathy and caring to your patients, that you're making that extra effort to communicate with them and to allay their fears and calm them down. So really appreciate your sharing that. Can you describe, on your website, there's the term active rest. Can you just describe for our listeners what you mean by that and what that is?
The active rest is a way of decompressing the spine and taking the pressure off joints and releasing movement muscles that have been tense. And anyone can go to my website and download instructions, and also there are illustrations of how to get into that and how to get up from there. So it's essentially lying on the floor on a yoga mat. It's best to be on a firm surface, and having paperback books under the occipital bump of the head, so that the head is supported to have that slight nodding forward relationship that I described in the first podcast, that the head is designed to be in a relationship with the spine, where the nose and the chin is just slightly forward. So in a lying position, it's important to have the forehead a little bit higher than the chin, because if the head is tipped backwards, as it is, for example, in yoga classes in Shavasana, it means that the head, which I said in the first podcast weighs about 5 kilos, is now compressing the spine. So anytime you're lying down, it's really important that you have that kind of relationship where your head is not tipped back. And there's a detailed description of how your feet should be with the knees bent, or it's even better if you can put your legs up on a couch or something that will take the weight off, give your legs support, and that is wonderfully relaxing for the whole back. And having cushions under the elbow, which then helps to release the tight shoulder and back muscles that we have, just about every dentist has. So there's a particular way of lying on the floor with support for the head, the legs, and also for the elbows for maximum release. It's a passive release of muscle tightness and joint compression, and particularly by lying down in the horizontal, we take gravity out of the picture. Gravity acts on us vertically as a downward force all day. And even if there's any lucky person who has brilliant work posture and in everyday life moves well, even then, that downward force of gravity is compressing the spine. And I don't know if any of you, your listeners or yourself, might know that in the morning we're 1.6 centimeters taller on average than when we went to bed at night. Just by lying in the horizontal, there's some decompression of the spine.
I did not know that. That is
most
really
people don't
interesting.
know that.
Nah, I did not know that.
Have you ever noticed that you adjust your rear vision mirror in the morning, or or when you get into your car after work? There's a slight adjustment. Some people notice that. That's the reason.
That makes sense. That's very interesting. Wow. So
I was amazed. Yeah.
Oh, go ahead.
So what happens when you lie in this support? So this is a particularly well-supported rest, where muscles are actually actively releasing without you doing anything. You're just making sure that you're lying well, and that's why it's important to look at the explanation, and I have very detailed description and instructions on how to do this. However, it's not, although it's very, very relaxing for the whole system, the neuromuscular and musculoskeletal system, it's not a relaxation where people collapse. Often when you say relax, people collapse. This is actually a way of lengthening and decompressing, but you're not actively doing anything. It is happening as you do it. And it's great if you can do it for 10 or 20 minutes. It shouldn't be more than 20 minutes. If you're experiencing neck and back pain to start with, do it only for 10 minutes and do it more often. And I've got instructions for that. And then as you're lying there, and again, I have instructions on how to use the directional thinking to maximize the release. And it means you're just thinking. And for example, and this both in the active rest in my training programs, and also when people are doing their dentistry and simulated dental treatment, of course, in my workshops. For example, if I teach, think of your shoulder going away, one shoulder going away from the other. So shoulder away from shoulder. And I recommend you think of this when you're lying down in active rest, but also when you're sitting and doing your dentistry, just thinking shoulder away from shoulder will actually switch off the movement muscles that shouldn't be active, for example, the upper trapezius. And without you doing anything, there's actually an instruction in your neuromuscular system to activate the right muscles and deactivate the muscles that shouldn't be active. So there's a lot of different body parts where you can do directional thinking when you're lying in active rest, which will then help you to very quickly, in a vector fashion, think of releasing the arm, for example, as you find a fulcrum for your non-dominant hand, as you hold the mirror, you just think of releasing that arm. There's a more detailed version to practice in the active rest. It is a highly restorative activity, and I do this every day, once or twice a day. It is just the most wonderful medicine. And I teach practice this, and after I've been out to a practice and I teach this, I usually get the feedback that everybody in the practice starts bringing in yoga mats and books and does that at lunchtime at the end of the day. And in fact, I recommend that if you've got a very difficult patient and you know that patient is coming in, book them before lunch or at the end of the day, and then lie in active rest to recuperate and restore yourself. I call it a restoration for your body. Restore yourself with the active rest.
Wow. Do you use other specialties such as physical therapy, yoga, spine specialists, etc., to diagnose and treat and maintain your patients who are dentists?
That's a very good question, Rich. So I don't actually diagnose as such. I recommend to everyone that if they've got any particular pain, that should be checked, that there isn't anything going on. For example, back pain can also mean pancreatic cancer and the various conditions. So I don't diagnose as such. And what I do is help with occupational chronic pain. So if pain is caused or contributed to by work postures, postural habits that are unhelpful, then I'll help them. And I do recommend that they use whatever medical practitioner and specialist and physical therapist they like to go to continue doing that, and they're welcome to. However, the important message I have is that until the habits are changed, none of those therapies which are really aimed at symptoms, for example, for my terribly sore shoulder, which I had left shoulder, I had that for decades. First thing Monday morning, I was in agony after resting it for the whole weekend. And no matter how much massage and whatever manipulation was done to my left shoulder, until I learned not to have my shoulder and arm up as I was holding the mirror, I was always in pain within a short time of having the very best treatments. So in combination with habit change, all of those things are helpful.
Okay. So,
and being active is helpful. And actually, may I just bring something else in?
Sure.
Our bodies were not designed to be sitting for lengthy periods, whether it's in front of the computer or especially doing dentistry. And so what I recommend very highly is that no matter how long your appointments are, at least after 35, 45 minutes, even if the treatment is continuing, just move. If possible, get up for a moment and just move, do a hula dance behind the patient. If you can't do it behind the patient, do it in front of them. They will think you're the coolest dentist. Because unless you move your body, you're stiffening, even if you're thinking about good alignment, good posture. I don't know if you know, but it's considered that sitting is now the new smoking. It's really bad for you. So we got to move. And also for stress management, you know that animals, when they've been chased and they somehow survive and run away from the predator, they just shake. That's the way they get rid of all that adrenaline. We tend to sit and stew in it. So if you've got a difficult patient, difficult procedure, as well as doing the I have time and in breath, out breath for yourself. If you can just, even in a sitting position, just put your instruments down and just shake your arms and do a little movement, even sitting, or get up and do whatever for a moment, that will also get rid of a lot of the stress hormones in your system and help with your, and protect you against stiffening and tightening.
Yeah. Again, great coaching. We have two more questions, and one more related to chronic occupational dental pain. How reversible is this chronic occupational pain? Or is reversibility entirely a function of how severe and chronic the damage? And I guess my real underlying question is, can you undo it back to essentially normal and no chronic conditions? Or if someone's really sustained significant damage, it becomes more of a salvage operation in terms of trying to get back as much function as possible. Can you guide us through what is possible in this realm?
That's a really good question, and it's a little. The answer is a little bit like how long is a bit of string. It does depend on, as you said, the severity of damage and how long it's been happening, and on the individual, it varies. To give you an example, I was in my early 50s when I started learning how I can help myself, and I'd been in severe chronic pain, often totally debilitated and unable to move, and had to cancel patients, and everything hurt. I was declared a hopeless case by my specialist and physical therapists, and it was just terrible. And so I had decades of chronic pain and a lot of damage that showed down on radiographs and scans. And I was able to turn a lot of it around. I'm not saying I now have the body of a 20-year-old. However, I went from literally being disabled to moving really well. However, I have to look after myself very well, and I'm mindful that I'm doing all the right things, and I do the active rest. Younger dentists, of course, can spring back to better health, and I'm now in good health. So yes, it depends on how long it's been going and what kind of damage. I need to share the sad statistics that a number of young dentists that I know of in their 20s and 30s and early 40s in Australia have had cervical surgeries, usually involving C6 and 7, which is the common area where dentists are bending forward to look into patients' mouth as they use their loops with insufficient declination angle. And I just wish I could have gotten to these dentists earlier.
Yeah, I can imagine. To just expand on one point which we haven't talked about very briefly, I'd just like to mention, I have a friend named Brian Hollander, and I met Brian in Kathmandu, Nepal. Well, actually, I met him in Oregon, but he raised his family in Nepal, and Brian lives in Anchorage, Alaska now. And one of the things that he, I've known Brian for years, but he said, I want to be active and be moving, and he practices yoga, and his wife practices yoga, and he's in constant motion. And the thought I'd never linked the thought between aging well and being healthy in the latter stages in life with being flexible and having your ability to use all of your movements. And the more that I started to think about that, I'm not being very articulate about it, but it really made sense to me that being in good physical condition and stretching and doing things the right way and preserving, our musculature and our frame, so to speak, and healthy bones. And this is obviously tied in with diet and a lot of other things. It was like the light bulb went off that if I really wanted to be around, I really needed to be not just physically active, but doing the right things in the right way. And how this dovetails with the podcast is I hear you very much saying that the movement is critical for our adaptation to the dental environment, in addition to putting ourselves in the right positions that are physiologic positions that matches our bone structure and our musculature. I'm sure I butchered that, but would you like to comment on that general concept?
Rich, I thought you expressed that extremely well, and I agree with you wholeheartedly. Moving at any age, but especially as we get more mature and sophisticated, I like to use that, and more experienced instead of aging. It is very important that we move, that we look after ourselves, and healthy diet, calming techniques. A lot of my friends who hadn't seen me for some time say that I look much younger than I did 20, 30 years ago, which is, it's really surprising. But I put that down to taking care of myself and good alignment. And also I've been practicing stress reduction techniques for a long time, and sweating the small stuff, and a lot of positive self-talk. And especially for young dentists who are learning complex procedures, not to compare yourself. Keep on training and have wonderful mentors, but having a very positive self-talk is very important. So being your own best friend at any age. And yes, we need to move and we need to take care. And yoga is among the very good things that one can do. However, I just like to caution dentists, if they are attending a yoga class, to make sure that they are being instructed by a yoga teacher who understands biomechanical design. For example, if you're doing a bend and trying to touch your toes with straight legs and knees locked, and your yoga instructor isn't telling you that you should soften and slightly bend your knees, then you're in the wrong place, because that can do a lot of damage to your back. So be discerning and train with good people.
Yeah.
And walking, swimming is excellent.
Oh, I so completely agree. I got introduced to something called TRX training, which are straps that are put on a beam above you, and there's just a multitude of different exercises. And boy, you can really tell very quickly if you're doing it wrong. And yes. I can really see the potential for harm and damage just by getting on YouTube and trying to duplicate what, these very nimble, athletic people who are professionals are doing. So I think your caution there about being in the right place with the right instructors and doing it at the right pace is really important. Final question for our listeners. I've really enjoyed our two podcasts, and I've learned a lot. And I appreciate the way that you clearly you know your stuff, but also the way that you've explained it, and the humanity and compassion that clearly comes through is really touching. So I want to acknowledge you for that. Final question. What's your best piece of clinical, personal, or financial advice for our listeners, many of whom are young dentists?
Very good question, and thank you very much for the acknowledgement. I am passionate about saving my colleagues, especially the young ones, from suffering the way I did for decades. So my advice is find yourself excellent dentists who are experienced and good clinical mentors. Have lots of discussions. Be your own best friend, and if you've had a hard day, just put your hands on your heart and just say, "Sweetheart, you've done the very best you could, and next time you might do it different," rather than put yourself down and disempower yourself. That's something I learned later in life, and it's made a huge difference being kind and compassionate. It's called radical compassion to yourself, and at times it is so easy to put ourselves down. You're going to keep on improving. Also invest in learning great communication skills. I don't know, Rich, if you've heard of active and passive listening or reflective listening.
I have.
You have. That is something I learned a long time ago, and that has served me very well, both in clinical practice, talking to my patients, my colleagues, my team, and also in my personal life. Being a parent, it has been a lifesaver. Learning and practicing those simple calming techniques that I mentioned, and also additional visualization, and the technique that I shared earlier is the noticing the in-breath and out-breath. If you can add to that you're breathing in mountain fresh air or the sea breeze, whatever your favorite place is, and you can really add to that and practice that whenever you notice that times are difficult and challenging, and just take care of yourself, then you will have a better quality life and have help, get feedback on what you're doing if you wish to do habit change, and also reach out and talk to other people. I know some dentists who are struggling, not just right now, and of course in current circumstances there's social isolation and distancing, but even in good times of dental practice, some people just go home and feel bad on their own. Reach out to colleagues. All of us have had hard days. Don't take it personally. Acknowledge yourself for being human. So I guess my most important message is absolute kindness to yourself, and then you can also be kind to others.
Well, thank you for sharing those key life strategies. And I want to just mention one thing, to emphasize one thing you said, which is about doctors not talking to other doctors. I don't believe that women have the same issue as men. I think men, because we don't want to be perceived as weak, because we don't want to be laughed at, we don't want to be made fun of, we don't share our problems, we don't talk about our problems. And I'm sure that this is ubiquitous across all men, not just dentists. But I've observed so many male dentists over the years who just literally, it's like they don't have any friends outside of the home. They don't have hobbies outside of the home, or they certainly, if they socialize, it's maybe surrounded by sports or alcohol, but they're not talking about what's really going on. And sometimes in the worst case scenarios, those are the guys who, ultimately end up potentially ending their lives. And the longer you're around practicing, the more of those really tragic stories that one hears, and you go, well, why didn't, John or Bob or Bill or whoever, talk to somebody about what was really going on? So to your point, for those listeners, make that extra effort to reach out to your colleagues and take the risk, especially if you're a guy, to just, make friends, be able to talk about things and share yourself. I've never really had this problem of worrying about looking stupid for reasons that I don't quite understand. So I reach out to people and I tell them what's going on and I listen. But I've just noticed a lot of my colleagues don't. So I really think that piece of your advice amongst the others is especially germane to me and to the other male listeners. I think women genetically, culturally, are much, much, much better communicators than we are as guys.
I agree totally, Rich, and I'm so glad you raised this point. And I need to tell you that when I first started practicing, there were hardly any female dentists in Australia, and so I used to go to all the regular meetings, and everyone was into what I call looking good. Everything is fine, house practice, yeah, great, whatever. And then some years down the line, I went to my very first Women's Dental Association meeting, and all I can say is, and I am a metaphor thinker, it was like walking into a warm bath of honey. Suddenly, people were sharing the struggles with kids and work, and we were just being honest and supportive. And I thought, wow, what a different meeting. And I find that for the most part, guys will say everything is fine when it's not. and women are far more willing to share, but not all women. Some women are also into just saying everything is good. What I'd like to recommend is on Facebook, there is a group called the Mental Block. It was started by, I think, female dentists, but there are lots of male dentists on it. It's a closed group, private group for dentists, and people share openly. I'm surprised at the degree of honesty. Some dentists have shared self-harming or whatever addiction, or desperate for help because they're feeling burnt out, and people are just able to share and listen, and there's no promotion on this. People can share their own experiences, and it's a very supportive group just for dentists.
And the name of that Facebook group is Mental Block or Dental Block?
Mental, M for Mary, Mental.
Okay, got it.
MENTAL. The Mental. I think it's called the Mental Block.
Okay. Wow. Well, thank you for sharing that. Well, Dr. Aniko Ball, I just can't thank you enough for your time and just what a pleasure it's been to speak with you. So thanks for coming on the podcast. And perhaps we'll be able to lure you back to record a third podcast at some point in the future, or maybe take one of these subjects and go into maybe a deeper dive. But thank you again, and it's really been fun to spend some time with you.
Thank you, Richard. It has been an absolute pleasure talking with you, and I love the way you integrate everything so quickly and add to it. And I would be delighted to talk further, especially given that right now I'm unable to offer online training courses to the United States and Canadian dentists. So if I can shed more light and break down into detail some of the topics we discussed, I would be delighted to be lured back and have some more conversations with you.
Awesome. You take care. Thank you very much.
Take care. Bye.
Bye. This episode of the Dental Clinical Companion is produced in partnership with Medmark, the U.S. publishers of Dental Sleep, Endodontic, Implant, and Orthodontic Practice magazines. Experienced and novice dental professionals alike turn to Medmark Media as their trusted source of information, knowledge, and education in the highly technical yet constantly evolving dental landscape. MedmarkMedia.com. Engineering and creative support from Christopher Bima, PanopticArtifacts.com. We look forward to having you join our next podcast. Thanks for listening.
Please remember to subscribe, rate, and review us on iTunes. Join us on Facebook, Twitter, Instagram, Pinterest, and LinkedIn for additional information and resources. To reach Dr. Mounts or to recommend guests or topics you would like featured, please email Dr. Mounts at dentalclinicalcompanion.com. Mounts Endo, LLC, Dr. Richard Mounts, and the Dental Clinical Companion podcast have no liability for any clinical, management, financial decisions, or other actions you take based on the information provided in this program. Please see the show notes for our complete liability release statement. See you next episode, The Dental Clinical Companion, bringing together the world's leading clinicians and experts to optimize your treatment, educate, and inspire and energize your professional goals.